Seeing a doctor for the diagnosis of colon cancer can be a pretty sobering experience. The good news is that even in the most serious stage of colon cancer, there still can be reason for some hope. Early diagnosis improves chances for a cure, as we learned at the Mayo Clinic, a National Cancer Institute designated center.
More than 80% of cancers detected by screening are cured.
Remember, the most important steps you take in cancer treatment are the first, and that begins with the right diagnosis and the proper staging to see how far the cancer may have spread. Your visit to the oncologist will be prompted by one of two events: either a screening test that has come up with abnormal results or symptoms suggestive of the disease.
Most patients that we see with colon cancer present with symptoms as opposed to because of screening.
Here are the key symptoms to look for: rectal bleeding, lower abdominal cramping, persistent changes in stool, constipation, increased frequency, decreased caliber of the stool, and late symptoms may be unexplained weight loss.
Rarely cancer of the colon presents with unusual symptoms, and those may relate to what we call paraneoplastic syndromes.
That can mean you develop joint pains, skin pigmentation, or muscle pain. If your doctor suspects colon cancer, you'll be referred for the gold standard diagnostic test, a colonoscopy. Gastroenterologists and colorectal surgeons have the most expertise performing colonoscopies. Key questions to ask your doctor: what are the completion rates? These should be 95% or greater. Complication rates. These should be less than 1%. During a colonoscopy, the doctor passes a flexible scope from the rectum all the way up, across, and down the colon, looking for polyps and for cancer.
Colonoscopy is limited to the inner surface of the colon in terms of what we can see with our eyes. However, there are tools that allow us to image the deeper layers of the colon, like a sonar, and one of those would be with what's called endoscopic ultrasound.
The sound beams can report back how deep the tumor goes and whether there are enlarged lymph nodes. If the diagnosis of cancer has been made, doctors will want to determine how far it's spread. A complete workup is critical to proper staging and treatment. But the actual stage of the tumor, that is how far it is spread, is determined during surgery.
They have the best opportunity to look at organs outside of the colon as part of the exploration with surgery.
After your general health is brought up to its best level, you're ready for surgery.